Hi, my name's Dave Welch, and I'm a registered nurse in Chico, California. I work in cardiac rehabilitation at our local hospital up there. I've been there for I've been a registered nurse for 26 years, been doing cardiac rehab for most of that time, and I spend my life teaching people about healthy behavior, keeping their cholesterol down and eating healthy and exercising and all those things, and try to do most of those things myself. And I've never really thought of the possibility that I would end up being a person who would have a problem with health insurance because of my good health, because I've been so conscious of it, because I work in a profession where I'm lucky enough to have pretty good insurance coverage. But last summer I decided that I had reached a point in my life where I was ready to go to per diem at work, meaning irregular hours and giving up my health benefits. And I thought that I would be a good candidate, having studied the situation pretty well, that I would be a good candidate for one of the high deductible insurance policies combined with a health savings account.
Insurance providence got to go! Insurance providence got to go!
For most people, a program like that's a disaster. But for someone like me who is quite healthy, relatively well off financially, and pretty medically sophisticated and able to be a sophisticated consumer, I'm actually one of the few people that it probably works fairly well for. And so I thought that that would meet my health insurance needs until I reached Medicare age.
In 2006, insurance that cost $100, for example, in 2000, now costs $187. That's an 87% increase from 2000 to 2006. That's remarkable.
But I also figured that I had a few things to do, and before I went onto that high deductible policy and started paying for all the little things myself, I would get a few things taken care of. Go to the dentist, go to the eye doctor, get some new contact lenses, things like that, get all that sort of stuff taken care of. And the last one on the list was go to the dermatologist. And my dermatologist, looking me over pretty carefully, discovers this tiny little skin cancer on the side of my nose, which really wasn't even significant enough that I had noticed anything there. Because of this little skin cancer, I am uninsurable according to Blue Cross of California and according to the other insurers who sell health insurance in my area. And this is, in some ways, I'm almost embarrassed to tell this story because compared to the kinds of disasters that many people find themselves in with health insurance, the kind of catastrophic situations with people being bankrupted by failures of their insurance, or people with awful catastrophic diseases, my problem is pretty minor by comparison. And yet, if someone like me, with what I know and with the good fortune that I have, if someone like me can end up uninsured and uninsurable, it really shows you that anyone can.
Currently, the United States spends about 30 to 60% more on our drugs than any other industrialized country. And it's because we allow the pharmaceutical corporations and the health insurance industry to dominate our healthcare policy instead of what really makes sense for our patients.
To realize that I probably live in the only industrialized country in the world where someone has to shape their life choices around making sure that they have health care. That's a ridiculous place to have to be.
We need to get the healthcare dog under control. That's not happening. We have an opportunity to do that right now. California's a CULE bill, so it's a good single-payer bill. Nationally, Conyers Kucinich with HR 676. We're long past time for something like that to happen.
One of the things that I've really wanted to be able to do more of one of the reasons I wanted to cut back on work is because I really enjoy long distance cycling. That's one of my great enthusiasms in life, and my wife and I take an annual tandem bike tour of 3 weeks or so, and so that's really, that's one of the things that I have really looked forward to being able to do more of. And of course the other thing that I've really looked forward to being able to do more of is political activism and activism in my union. And so I had sort of mapped out a life for myself of doing a lot more of both of those things. And so that's probably not going to be able to do that as things stand right now.